An FUE punch is a razor-sharp circular tube, but the hair underneath your skin is curved. So, how do surgeons avoid slicing the graft in half? The answer lies in the geometric mismatch between a rigid cylindrical tool and the dynamic, curved trajectory of human hair follicles. Below the skin surface, the visible hair shaft gives way to a follicular unit that curves and splays outward. An FUE punch, typically measuring 0.7 to 1.0 millimeters, must translate downward force along this acute exit angle. In his clinical approach, Dr. Erkam emphasizes that visualizing the superficial exit angle is only the first step. The true subsurface path must be navigated entirely through delicate tactile feedback. Transection occurs when the rigid punch vector misaligns with this natural splay, mechanically slicing into the follicular bulb or dermal papilla. This irreversibly destroys the structure's biological ability to regenerate. To prevent this, the sharp punch is strictly limited to severing only the superficial dermal attachments. Dr. Erkam's approach to this procedure focuses on limiting punch depth precisely, which allows the curved lower portion of the follicle to be safely pulled from its deeper subcutaneous pocket without severing its base. From a planning perspective, Dr. Erkam stresses that preserving donor geometry and preventing overharvesting ultimately protects long-term tissue viability. Clinical evidence and guidelines indicate that keeping transection rates low requires careful depth control and an intimate understanding of scalp tissue mechanics. Ultimately, successful extraction isn't merely about following a hair shaft. It is a precise mechanical negotiation with the dynamic biology hidden beneath the skin.